Hi, I'm Heidi. I'm a Master Public Health candidate at Eastern Washington University. As part of my APE or Applied Practice experience, I partner with Mid-Iowa Community Action, MICA, to develop a bilingual lead screening awareness campaign focuses on protecting children and empowering families in Story and Marshall counties. This project holds great significance for me, both as a healthcare professional and as someone who deeply cares about health equity. Many families still face barriers to basic screening service, and I want to create a simple, culturally tailored tools to help bridge that gap. Through this video and campaign, I hope to raise awareness about the dangers of lead exposure, and most importantly, shows that with the proper support we can keep our kids strong, safe, and lead free. And this is Iowa, a beautiful state with vibrant communities, strong families, in like many places, some high-end public health challenge. For this project, I focus on Story and Marshall counties, two central Iowa communities where the risk of childhood lead exposure remains a concern, especially in older homes and underserved neighborhoods. By targeting these areas, our goal was to raise awareness, increase lead screening rates, and ensure that no child is left at risk due to a preventable condition like lead poisoning. These counties represent not just a data points, but real families, real kids, and real opportunities to make a difference. Here is a troubling reality. Only 33% of children in Story County and 46% in Marshalltown are getting tested for lead. That means more than a half of the kids in these areas might be exposed, and we will not even know. So we ask ourselves our tricky questions. What's getting in the way of lead screening in our community? Is a lack of awareness, transportation, language barriers, or it is that many families don't know lead poisoning is still at risk. Whatever the reason, we can fix what we don't face. And this campaign is all about changing that. So I start asking questions. Through bilingual surveys, community conversations, and caregiver interviews, I began to understand the real barrier families were facing. It wasn't just about scheduling an appointment. Families share stories of confusion, frustration, and feeling left out of the conversation. Many didn't know where to go for testing. Some were unable to find information in their native language, and others told me that nothing out there felt made for them or their kids. This insight made me one thing clear. If we want to improve screening rates, we have to start listening. As part of the campaign, we create a short bilingual survey to better understand what caregivers in the community know about lead screening. We ask questions like, have you heard about lead screening? Do you know where to get it? How important do you think it is for children's health? How would you like to prefer this information? This response helped shape our outreach, making sure materials were not only informative, but also easy access, culturally relevant, and available in both English and Spanish. When we asked caregivers if they knew where to access Let's Screening service, the results were eye-opening. Nearly 54% say no, they didn't know where to go. Another 12% were unsure, which means that over half of the families are navigating this without clear guidance. And yet, we ask how important they believe screening is for their child. Over 55% say it's essential. So, what does it tell us? Parents care. They want to protect their kids. But if they didn't know where to go or how to start, good intentions alone aren't enough. That's where our outreach, education, and culturally tailored resource comes in. When it comes to getting the message out, knowing how and in what language to communicate is everything. Among the 49 caregivers we surveyed, 86 prefer English as native language, while 40% choose Spanish. That tells us most outreach should be in English, but we must not forget the importance of reaching in Spanish-speaking families with cultural appropriate message. Now, at how they want to receive that information. Nearly half, 49%, say text message are the top choice. Emails came at 24%, followed by flyers, social media, and other channels ranked more lower. So what does that mean? We should lead with mobile-friendly direct communication, especially texting and email. Flyers still matter, especially in clinics and schools, but our strategy needs to be digital first and language accessible for all. Hey parents, quick question. Did you know Let My still be hiding in your home? Yep, right there with the laundry pile, the lost sippy cup, and one of the socks that they don't match. But don't panic. Get your kit tested. It's easy, fast, safe, no drama, no needles, no excuse. Meet Mateo. He's 4 fearless and has 2 speed, fast and faster. Whether he's climbing, sliding, or running, full speed toward to a puddle, Mateo's favorite job is being a kid. But there is something Mateo doesn't know, and neither most parents. It is silent, sneaky, it is harmful. We are talking about lead. Lead poisoning is one of those things you think only happen to other people in all movies. However, the truth is that it can be still present today in places where less expected, such old paints, pipes, dust inside the homes well before 1978. And while you won't see it or smell it, lead can slowly harm your child's development, making it harder for them to focus, learn, or behave the way they usually will. We all want strong kids, happy kids, curious kids who climbs everything and asks 100 questions before breakfast. That starts with safe homes, and a simple test can make a big difference. Let's work together to keep our kids safe, healthy, and ready to take on the world, one playground adventure at a time. Public health is not just about data and disease. It's about dignity, equity, and the quiet power of prevention. And thanks for watching this video. Thank you.